When you have a device implanted, you're reliant on the battery working and the leads working. And so what a devices clinic does is to check that those things are indeed working, that there's plenty of life left in the battery, and that the leads are in good condition and not causing any problem to the patient. They will also check on the wound to make sure that there's no infection brewing or no problem with protuberance of the device, and should be an opportunity for people to ask questions about their device and any symptoms that they may have experienced. What a device clinic isn't usually is a place where you can ask detailed questions about your medication or your underlying condition. Certainly in the UK, then the device clinics tend to be run by cardiac physiologists who are experts in looking after devices, but don't always have all the knowledge around drug interactions and underlying clinical conditions. And so usually if there's a question around that, then they will ask for one of their medical colleagues, or sometimes the arrhythmia nurses will come in and help with some of those questions. But it's basically just to make sure that people are being followed up and have a good understanding about their device. So within a pacing clinic or a devices clinic, then the arrhythmia nurses are usually involved in counselling the patient to make sure that they've understood all the pre-op information about their devices. They are often called on to look at any wounds that look like they might be infected, or to make sure that stitches don't need to come out or anything like that. And often nowadays then a lot of our arrhythmia nurses have also undertaken further training to be able to prescribe medications, and so if there is any question around medications, then the patient can ask the nurse around those. Some areas then the arrhythmia nurses actually run device clinics, but that's still a minority of cases. In the United States though, then they don't have cardiac physiologists, and actually nurses with special EP qualifications, they run the devices clinic, so it does vary around the world.